Welcome to Parenting GPS, navigating your parenting journey. I'm Kari Kling, the host and creator of the show. Today, we have a special guest with us who's going to be sharing all about raising children with anxiety and OCD. Now, I have to tell you, when I began my professional educational career, my teaching career in 1981, and I've said this before, it was very rare to have children with any kind of a label that had to do with emotions or really anything. I think I went my first 5 years of teaching, maybe having only one child with any kind of a label. Now, it's very possible that we were just underdiagnosing different syndromes or behavioral issues, but I think something more is at play. In fact, in the United States, the average is approximately 20% of children in classrooms have some kind of label. What in the heck is going on, and what can we do to help our children? Today, I'd like to introduce to you our guest, Natasha Daniels, and she's going to help us to understand this. Natasha Daniels is an anxiety and OCD therapist with over 2 decades of experience. She combines both her clinical expertise with her lived experience, raising her own 3 kids with anxiety and OCD. She is the author of several books, including Anxiety Sucks, a Teen Survival Guide, How to Parent Your Anxious Toddler, Social Skills Activities for Kids, It's Brave to Be Kind, and The Grief Rock. She is the creator of the At Parenting Survival, as well as the host to the show At Parenting Survival podcast and the YouTube channel Ask the Child Therapist. Her work has been featured in the Huffington Post, Scary Mommy, Psych Central, the Child Mind Institute, and the Mighty. Natasha, thank you so much for being here today.
Yeah, thanks for having me. I appreciate it.
Oh, it's my pleasure. And as I shared with you earlier, I found you on Instagram. It was actually a suggestion of a friend. You have to follow this person. And I just feel like your work is so authentic, and you provide so many easy strategies for anybody working with children with a label of anxiety or OCD. And so I'd like to start today by just asking you, what do anxiety and OCD look like in children? What are the signs and the symptoms, and what age do we normally start to see these kinds of behaviors?
You can kind of see it pretty early on, depending on when it's going to come. If it's going to be early onset, a lot of times, and that's kind of why I wrote that book on toddlers, because sometimes we can see it in toddlerhood and it looks a little bit different than as they get older. But all kids are anxious at some time. I mean, it's developmentally appropriate that kids get anxious, especially as they go through different developmental stages. But I think when you see kids who are overwhelmed by things that other kids are able to do in a more smooth way, go to sleep, separate, go to school, eat different foods. So when you see kids having struggles above and beyond what's developmentally appropriate, and that fear is causing so much avoidance and so much panic, then you're looking, at a lot of anxiety issues that are becoming, a barrier, I guess, to their ability to function. OCD looks completely different. Sometimes we lump these together, but to me, I see them as 2 very different disorders. But with OCD, you might see your child doing some nonsensical behavior. You might see that we think of them as over hand washing. That's like the obvious one that does not get missed. But your child might have intrusive thoughts, and they have to overly confess their behaviors, or they have to ask you reassurance questions without getting satisfied with your answer. They might do behaviors that seem odd, that are kind of, they look like quirky habits, but they're not. They're compulsions in disguise. So those are just a few things to look at.
And you mentioned about some people see OCD and anxiety as similar, but you see them as very different. But what is the relationship between the two as you see it as a mom and also as a therapist?
And Unfortunately, anxiety and OCD are comorbid conditions. And so
Mhm.
they like to hang out together. And so that muddies the waters because I have two kids with anxiety and OCD. And so it got the anxiety, but they also have the OCD component. OCD also likes to hijack anxiety themes and make it its own. Um, so that's how they can kind of interact.
Mhm.
We used to think that, OCD was diagnosed, it was not diagnosed, but it was under the DSM as an anxiety disorder. And now
Mhm.
it's separate. And, it's kind of controversial where it goes, but it's two different parts of the brain and it shows up differently. And the therapeutic approaches for OCD is very different than anxiety.
And we're going to talk a little bit in the second segment about how parents can help their children, what to say to them, maybe what not to say to them, to help them with that. And we're going to talk a little bit also about the factors of why we're seeing that. But we are seeing more, as I mentioned in the introduction, more children with labels than we ever have before in terms of mental and emotional health. And it could be depression, it could be anxiety, OCD, it could be ADD, ADHD. And I've done, entire shows on this. What are the statistics? What are we seeing in terms of an increase, and why do you think it's happening?
Uh, you know, there's a lot of thoughts on that. It used to be that there was about 11.5% of kids with anxiety symptoms. And since COVID, that's almost doubled. Now it's 20.5% of kids show anxiety symptoms. That's not even the whole umbrella of mental health issues. That's just anxiety. The old statistic for OCD is 1 out of every 200 kids has OCD. I think that's grossly underestimated. I think OCD is missed most of the time, and certainly in younger kids. And so my thought is that's probably higher. But why? I mean, we can all guess. I mean, we can all make speculations. It's just an opinion, I think, at this point. I don't think COVID helped,
Mhm.
both emotionally and physiologically. I feel like COVID has been implicated in inflammation. And so to me, it's not rocket science that mental health issues are on the rise when inflammation is a component of that, because I feel inflammation is kind of indicated in a lot of mental health issues.
Mhm.
So to me, that's not surprising. I think also just the level of instability that our kids had to experience in the last few years has rocked their foundation.
Right.
It's rocked all of our foundations. So I think that has a huge component on our kids' mental health, that that stability is not there, that naivety is not there, that everything is okay. So we are
Yeah.
seeing an increase, not just with kids, we're seeing an increase in mental health issues across the board.
Absolutely. And you mentioned about COVID, and I'm glad that you brought that up, because it's not just if you had COVID and then you have the inflammation that maybe it's still there, but it's that even if you didn't have COVID, kids were isolated and they didn't have their normal activities and they didn't have their normal routines. And that had to play a role in all of that, I'm sure. But it's very scary, and I think we have to, as adults, try to get to the bottom of why is this happening, because where are we going to be in 5 years or 10 years if these statistics keep increasing?
Yeah, definitely.
So when we come back from our break, Natasha, we're going to start to talk in more depth about some other issues. I want to talk about an illness that we know can be triggered through illness, like we talked about, but it's not COVID. We're going to talk about how do we talk to our kids? How do we validate them? How do we empower them if they are dealing with anxiety and OCD? So we'll talk about that when we come back. In the first segment, Natasha, we started to talk a little bit about some of the causation. You mentioned about COVID. We mentioned about not only inflammation, but about what happened with the pandemic. What are some of the environmental and genetic factors that we know play a role? There can be a genetic factor, correct?
Yeah, anxiety and OCD are both highly genetic. And so there is a predisposition genetically for our kids to get anxiety or OCD if it runs in the family. And that could even mean, other mental health issues. So, offspring of kids with parents with bipolar, like that's in my family. You know, my father had bipolar, but it's more common for the offspring to get anxiety disorders. So having mental health issues in your family puts your kids more at risk for having those things as well.
So there is a genetic factor, and then also the environmental factor, like we talked about COVID, we talked about, the isolation. There's also something that's illness related, and it's called PANS and PANDAS. And PANS stands for pediatric acute onset of neuropsychiatric symptoms or syndrome. And PANDAS, which is really under that, if you think of PANS as the umbrella, is really connected to strep 86% of the time. And I wanted to share with people what it is and then ask you about that. PANDAS is an acronym for pediatric autoimmune neuropsychiatric disorders associated with streptococcal infections. And it doesn't mean if your child gets strep throat that they're going to automatically get this, but strep is what kicks it off 86% of the time, approximately. And it could be brought on by another virus, another bacteria. And then once the child has that, anything can bring it on. But that can cause symptoms of anxiety and OCD, as well as a lot of other things. What should parents do? Can they go get tested for that? What should they do if they begin to see a sudden onset, which is how that's categorized more often, of anxiety and OCD?
Yeah, I think it's good to be aware that there can be a physiological cause to anxiety or OCD. I actually feel like anxiety and OCD, and especially OCD, is caused by lots of different things, and that is one component of it. So when it runs in your family, do autoimmune issues run in your family? I mean, I think there are so many layers that we don't even know.
Right.
But I think it's good that parents, who are raising kids with anxiety or OCD, should educate themselves on the symptoms of PANDAS and PANS. I always recommend that people go to pandasnetwork.org and just look up the symptoms. Because the OCD is only one component, or anxiety is one component, restrictive eating, or regressive behavior, or a math decompensation, or motor skill decompensation, or, meltdowns, having kind of the profile, and then finding a PANDAS PANS specialist to run some tests or, do an assessment is really key. You can find providers on that website as well in your area.
Absolutely. And you just hit the nail on the head. It's not about assuming, oh, my child is behaving this way or these signs and symptoms because of this, we don't know, but you want to explore all of the options. And if anybody out there wants to know more about that, I agree with Natasha. Pandasnetwork.org is a wonderful resource. I also did an entire show. It was the second show. You can go to my website at karikling.com, look at the parenting GPS page. It was the second show. The entire show is about PANS and PANDAS, and it's 1 in 200. And so if your child starts behaving in a way that it's like, wait a minute, this isn't how they were a week ago, there's something's going on, it would be very wise to at least check it out and have those resources there. And so one of the things, Natasha, and I've observed this in my own one-on-one parent coaching, if a child has anxiety or OCD, sometimes the parent just out of frustration says, just stop, just don't do that, just stop. And that doesn't really work. The only thing that does is really just increase the frustration with the parent and the child most of the time. If a child is exhibiting a behavior related to anxiety or OCD, what do you recommend they do? How should they speak to their child?
Yeah. And ironically, when we say that, which I mean, I am completely guilty of doing as well, because I think we're all human. So
right.
Everyone's probably done that at least once, but it actually makes kids more anxious. I know it makes my kids more anxious when I say, like, just pull it together, especially if we're in public. It is better to validate. And so it sounds like a very subtle shift, if not even significant at all, but it does make a huge difference with my kids and the kids I've worked with in my practice, just shifting it. And I'll say to my kids, I know this is really hard. I know this is overwhelming, but you've got this, or you can handle this uncomfortableness or this discomfort. So that it doesn't sound like much of a shift, but just validating that, yes, this is a struggle. I get this is a struggle for you. And sometimes it'll be a struggle that seems like so inconsequential, something that isn't a big deal. And so when we say it isn't a big deal, you're fine. What is the big deal? Which is a normal thing to say to our kids. I mean, I think that's just something that comes out of our mouth as parents. It can put kids on the defensive, and then it can impact their self-esteem too, because they're like, what is the big deal? Why am I having this big reaction? So validating first, and then that message, the underlying message of, I know you can get through this, even if they don't believe it, and even if you don't believe it. Conveying that you have confidence that they can handle the discomfort is key as well.
Yeah, it's so important. And I even know some families, and I've worked with some families where they practiced in private, before they went out in public. So it's like, okay, if you see, something that is going to be a trigger for that anxiety, for example, doing something at home, or when it happens naturally, and trying to work through it, so that when they are in public or you're not there to encourage them, they have some more tools in terms of what they can tell themselves, correct?
Yeah. And you really want to get to that core fear. So instead of kind of just talking about coping mechanisms of, take deep breaths and, or whatever you're going to, grounding techniques, those are all good ancillary approaches, but having that child realize that I'm having this anxious thought, and then what is a reframe that I can have? How can I have a different relationship with this fear is really important too.
Exactly. And one of the things that I know can be helpful is kind of a desensitization. So if a child is afraid of feeling anxious about loud noises, that's just something that came to my head, maybe having them, I don't want to use the word practice, but exposing them to a noise that maybe is a little tiny bit louder than they're comfortable with, and then maybe take it up a notch and keep going, so that you're desensitizing, if you will. Is that something that you recommend parents do?
Yeah, absolutely. I mean, exposure therapy is a game changer. And it's sometimes parents feel like exposure therapy is like throwing your baby in the deep water and asking them to swim, but it really isn't. It's like baby steps.
Right.
I almost look at it like, if you have a peanut allergy, you get these shots to kind of inoculate you. You're introducing peanuts one little step at a time. And I feel like with kids with anxiety and OCD, ERP, exposure response prevention, is the type of therapy that I have done and that I recommend, is just exposing them to that uncomfortable feeling one small step at a time. And it's
Right.
can be really effective.
And so if people are interested in that therapy, where do you recommend that they look, or do you have podcasts about that?
I
Where
do
do
have a
they go?
podcast on like what is ERP, so you can explore it. The International OCD Foundation has a list of providers, and anyone who is, saying they're trained in OCD will do ERP, or they should. So iocdf.org/find-help is a great place to start. That's their directory over there.
That's awesome. Because the biggest thing for parents sometimes is, what do I even put in the search engine to find help? But coming from an expert like you, that really provides some kind of guidance. And so when you have a family with multiple children, and let's say perhaps you have one that fits into the category, and I don't like to use labels, with children, but a child who is more neurodivergent, maybe there's anxiety and OCD, or OCD, maybe there's ADD, ADHD, whatever it is. And then you have another child perhaps, or more children that are more neurotypical. Sometimes the child that is struggling with some of these issues takes more of the parent's time, for lack of a better way to put it. And they seem to get more attention because they need it. How do you encourage parents to make sure that the child who is more neurotypical and perhaps doesn't need all of that attention in terms of that kind of an issue, so that they don't feel left out or left behind?
Yeah, it can become a huge issue. And even if they're not, neurotypical, they might have their own struggles, but they may not be your front burner issue at that time. I mean, I know we're dealing with that with both my kids. My son's the bigger issue right now, and my daughter is feeling that. It impacts the whole family when kids struggle. And so what I try to do is I pull her to the side and have private conversations with her and explain, I know that this is hard for you right now. And I know that I am all my energy is going to your brother. So I think letting your child know that you recognize what's going on, you recognize how it's impacting them.
Mhm,
And I have carved out special time for her.
mhm.
And that's hard when you're exhausted already and you're dealing with, things that are on fire metaphorically. But I've said, we're going to go out on Sunday by ourselves for an hour just so you can get a breather, I can get a breather, and I can be with you fully. And so I think having that dialogue separate and away from the other child is so important.
I agree with you completely. And here's just another idea for parents out there that I've seen used is an interactive journal where a child, and this could be any of the children, it could just be a notebook, it doesn't have to be anything fancy, where they have a place to write how they're feeling at that moment, because you might not be available at that moment, and then you can go back and respond to them at a later time. And at least that way, like you talked about earlier, Natasha, about validating, at least they're feeling heard and they're feeling like their voice is important, even though maybe they didn't get a chance to verbally say what they wanted to say to you at that moment. So there's another option.
Yeah. And even if you want to take it like a little bit more modern, my daughter will text me,
There you go.
she'll text me funny videos. And so she's connecting with me even when I'm maybe in the middle of dealing with a crisis.
Yeah. And I think the most important thing that and I know you'll agree with me on this, that I want parents to know, who are, no matter what the label is that your child might have, is never, ever, ever give up. That things can always improve and always get better, even if it feels like it won't. Would you
Yeah.
agree? Yeah.
Yeah.
Yeah, it may take time. And speaking of other people, Natasha, we have some questions from our viewers that have been written in for me to ask you on their behalf. And so as soon as we come back, we're going to take a look at those questions, and I'm going to ask you to respond. We'll be right back. This is the part of the show where we take our questions from you, our viewers, and I like to call it your parenting destination. And our first question, Natasha, is from Rita L. in San Marcos, California. And Rita writes, my 8-year-old daughter has a great deal of anxiety about many things that happen outside of our home. Do children ever grow out of anxiety on their own?
Some kids progress through it. I like to look at it like we're going to build some resiliency skills. And so, regardless of whether their anxiety stays or not, their ability to cope with any life change or any struggle can can be increased by building up their skills at this age. And so, um, I've seen a lot of kids who have acute anxiety disorders, and the parents build up their resiliency skills. They create kind of a therapeutic home environment, and they're taught how to walk towards their discomfort,
Mhm.
and they are almost anxiety free as adults.
Yeah. Yeah, it's as I said, don't ever give up. And if you need outside help, no matter where in the world you're watching this from, between all the podcasts and all the videos and websites out there, as well as a one-to-one coach, therapist, there's a lot of help out there. You are not alone. Our second question today comes from Marlo from Baltimore. And Marlo writes, my son is 10 years old and has been diagnosed with anxiety and OCD. I feel completely overwhelmed and feel like I'm so focused on helping my son that I don't take care of my physical and emotional needs any longer. How can I prioritize my own needs and health and still do what I need to do for my son?
Yeah, it's a great question because when you're parenting a child, especially with anxiety and OCD, it's exhausting. You're normally hooked into the compulsions. And so recognizing that our part, we have very little that we can control. Our kids have to really take those skills and use it. But the part that we can control is being their anchor, you know, helping coach them. And we can't do that if we're depleted. I think of it like a used battery. And so it's a component that is part of their mental health, is for us to take care of our mental health. Because if
Mhm.
you're depleted, you're not an anchor, and then you can't coach your child and cheerlead your child. So carving out time, which I know can be very hard, and that will look different for each person,
Mhm.
is so helpful. And I know I've had to learn that myself, and I had to teach kids and parents in my practice to do that and really identify what things recharge you, and not just bubble baths and candy, but can you put can you listen to an audiobook while you're doing the dishes, or can you what things will help you kind of step back and recharge every day.
Yeah, it's kind of like putting your own oxygen mask on first, right? Before you
Yeah.
can help your child. Absolutely. And one other thing you mentioned in the first segment, and also again about compulsions, for people that maybe are not familiar with what a compulsion is, could you just give a brief description for our viewers, please?
Yeah, I think people don't realize what OCD is in general, which is having an intrusive thought or feeling and having to do or avoid something to get that brief relief. So it's kind of a two-parter, and that doing something or avoiding something to get that brief relief is typically a compulsion. And so a compulsion could be what we stereotypically think of as like hand washing. It can also be like compulsively asking you for reassurance. Is this poisonous? Did I touch that? Am I a bad person? It could be tapping things. It could be moving your body in certain ways. It can literally be anything, but it's because you're doing it to reduce the distress the intrusive thought is causing.
The discomfort. Absolutely. And it's different for every child and then every adult that is
Right.
dealing with that. So thank you for that clarification, if you will. And Natasha, we are almost out of time, but I'd like to ask you to share with our viewers, how can they learn more about you, follow you on social media, your website? Please share any information that will help our viewers find you and more information.
Yeah, you can always find me at atparentingsurvival.com. And there you'll find my podcast, my YouTube, links to my school. I have an online school, and the resources that I provide.
And I know you also do free webinars and all kinds of opportunities. And so if you're a person out there who's thinking, I think this is what's going on with my child, or I know this is what's going on with my child, I really want to encourage you to look at Natasha's work. And I know it will be helpful to you. And so on each show, I like to end with a quote from our guest. And so, Natasha, the quote I'd like to use today from you is this. And you said, there may be times that our kids have to advocate for their needs when it comes to their anxiety or OCD. Learning how to find their voice and communicate their needs is a huge skill that will benefit them throughout life. So it's not just about placating them and saying, you'll be fine and do this. It's about teaching them to be their own best advocate. Thank
Yeah.
you so much for joining us today, Natasha.
Yeah. Thanks for having me. I appreciate it.
It's my pleasure.